This video is about OET writing task. Welcome to another exciting episode where we break down all the tips, tricks, and strategies to help you conquer the OET writing section. This is the place to be if you want to nail that referral, discharge, or clinical letter with ease. So, I'm not here to just give you some boring or dry information. We are going to dive deep, break things down, and I will show you how to make these tasks your secret weapon to a top score. Ready to get started? Grab a pen and paper. It's about to get interactive. Let's start with one of the most important things in writing your OET letter structure. Think about it like building a house. You need a solid foundation walls, right? A roof to make it strong. Similarly, your letter needs a clear logical structure to stand tall. Imagine you're a doctor and you have a patient named Sarah who has just been diagnosed with high blood pressure. You need to refer her to a cardiologist. And here's the structure you should follow. Okay? Dear Dr. Smith, I'm writing to refer Miss Sarah Thompson, a 45-year-old female patient, for further evaluation and management of her newly diagnosed hypertension. And in the body, you can just give Miss Thompson presented with complaints of occasional headaches and dizziness over the past 2 weeks. Her blood pressure today was 160/100 mmHg. Her medical history includes obesity and a family history of cardiovascular disease. She has been prescribed lisinopril 10 mg daily, and then you are going to do a request for action. So here you will write, I would appreciate your assessment and any recommendations for her ongoing treatment, including lifestyle interventions and possible adjustment of her medication. And in the closing, you can say like, thank you for your attention to this referral. Please do not hesitate to contact me should you require further information. And you can sign off with your name and your designation. Okay, so here you can see how easy it is to follow a clear structure. You have introduced the patient, you have given the details, and you made your request and signed off politely. This is the best way to ensure your letter is logical, professional, and easy to follow. Think of it like telling a story where you guide the reader through the essential details step by step. Now, let's talk about something that you can make your letter stand out: medical vocabulary. So, this is your chance to show you know that you're talking about, but don't go overboard. Remember, accuracy and clarity are the key. So, don't try to use so much of fancy vocabularies. Imagine you're writing a discharge letter for a patient who has been hospitalized for pneumonia. Instead of using simple terms, spice things up a little with advanced vocabulary, but in a way that's still understandable. Got it? So, basic example is the patient was treated with antibiotics and is feeling better. They need to follow up in 2 weeks. Now, let me show you the enhanced example. Mrs. Linda Miller, a 60-year-old female, was diagnosed with community acquired pneumonia and was treated with intravenous antibiotics for 5 days. Her condition has improved significantly and she is now stable enough for discharge. She is advised to complete a 10-day course of oral antibiotics and written for a follow up consultation in 2 weeks to assess her recovery. Now, see how the second example, the enhanced example, sounds much more professional and detailed. If you see the words like community acquired pneumonia, intravenous antibiotics, follow up consultation, make the letter sound more informed and trustworthy, right? So, this is the kind of language you need in your OET writing because it shows you can effectively communicate medical details with precision. The third one that I want to talk about is clarity and precision and avoiding ambiguity. Okay, so this is one of the biggest killers of any OET letter: ambiguity. No one likes unclear writing, especially healthcare professionals who are reading your letter, right? Here is an example. Let's say that you are writing a referral letter for a patient with severe back pain. And here's what you don't want to write. Okay, the patient has been having back pain for some time and was given some treatment. Please see the patient soon. Confusing, right? It's very unclear what kind of treatment was given, what sometime means, and what soon means. You've got to be specific, right? Now let's fix that and make it clear. So here's the clear example. This is how your writing should be, not in a very ambiguity mode. Mr. David Grant, a 35-year-old male, presented with acute lower back pain, which has persisted for the past 2 weeks. He was treated with a course of non steroidal anti inflammatory drugs, but his symptoms have not improved significantly. I'm referring him to you for further evaluation and potential imaging studies to rule out any underlying spinal pathology. An appointment within the next week would be greatly appreciated. So, you can see how the clear example clearly outlines the duration of the pain, like past 2 weeks, the treatment given, NSA-8, and the next steps referring for further evaluation. Got it? Specificity makes your letter not only clearer but also more actionable. Okay? And the fourth one that I want to talk about is the tone and formality. Because in healthcare, it's very essential to maintain a professional tone in all communication, even when you're writing a referral letter. Tone means the way you express yourself, and formality refers to how polite and respectful your language is. Let's say you are writing to a colleague about a non urgent issue. Here is an informal tone, okay? Hey, Dr. Sarah, I'm sending you this patient's details for follow up. Could you see them sometime soon? Not ideal, right? We are dealing with professional healthcare, so we need a polite and formal tone. Now, let's try to rephrase it. And this is the formal example. Dear Dr. Sarah, I'm writing to refer Miss Angela Williams for a follow up consultation regarding her ongoing treatment for type 2 diabetes. I would greatly appreciate it if you could see her at your earliest convenience. Please do let me know if you need any further information. You can see in the second formal example, we are still being friendly, but we are respectful, polite, and professional. Remember, the tone is just as important as the information because it helps you sound competent and trustworthy. So, always keep your audience in mind and you need to match the level of formality to that situation. Got it? Now that you have a good understanding of how to structure your letter, use precise vocabulary, maintain clarity, and keep the tone professional, you're well on your way to acing your writing task. And remember, practice makes perfect. So keep refining these skills and applying them to different scenarios. I want you to try this now. Think of a health related situation, whether it's a referral, discharge, or clinical case, and you need to write a short letter. Be sure to follow the tips we covered today and drop your examples in the comments below. Let's see how you apply these strategies. Okay, so that's all for today's OET writing tips. If you enjoyed the video, don't forget to like, subscribe, and hit that notification bell so you don't miss any of our upcoming OET preparation content. Keep practicing, stay confident, and you'll be on your way to a fantastic score. So until next time, good luck and take care. Bye for now.